Cervical cancer is screened for with a screening pap smear, and the recommendations are to begin these around the age of 21 or earlier high-risk activity. And with the screening pap smear, what you're doing is you're looking for abnormal cells on the cervix. And by doing these, follow the guidelines either yearly or every 3 years if you're doing it in combination with HPV testing, patients can be caught early on with an early stage cervical cancer. And these are the ones that really are most amenable to a fertility sparing approach. So women should definitely be seeing their gynecologist annually and having their pap smears, and if indicated, their reflex HPV or human papillomavirus testing done on these pap smear specimens. So as we know, cervical cancer affects about 15,000 women in the United States each year, and globally it's a much larger issue. About 40% of women who get diagnosed with cervical cancer will have an early stage cervical cancer, and the majority of these women will be young, under the age of 40. And we know now women have kind of put off childbearing, and so oftentimes these women are diagnosed and haven't yet had their first child or would like to have additional children. So in the past, traditional management for cervical cancer would be removal of the uterus and cervix, what's called a radical hysterectomy, and that obviously eliminates or greatly reduces any possibility of future fertility. So one of the things that we have since developed in the last few years is a fertility sparing approach, which is through the use of a fertility sparing radical trachelectomy. And essentially what this is, it's the same surgery, but instead of removing the uterus and the cervix, we're able to remove just the cervix with the surrounding tissue needed for a good cancer outcome and able to preserve the uterus. And these patients can then go on to conceive and deliver children, and this can be done oftentimes without the additional reproductive assistance. Women who are candidates for fertility sparing surgery often have an early stage cervical cancer, so a stage 1A through about a stage 1B1, and these tend to be smaller tumors that are confined to the cervix. They have to actually be of reproductive age and a desire to maintain their fertility. Additionally, there really should be no evidence of metastatic disease, so oftentimes practitioners either order additional CT scans or MRIs to make sure there's no gross involvement of the lymph nodes. These women should obviously be able to tolerate a surgical procedure such as this, and really should be done by a multidisciplinary approach, including the G1 oncologist as well as a reproductive endocrinologist, so women can really understand what their future fertility may be.